Welcome to Module 3, How Falls Can Be Prevented. By the end of this module, you will be able to include fall prevention into your daily work and talk about fall prevention with clients and families. As presented in Module 2, there are multiple risk factors for falls, and they do not exist in isolation. They are complex and interactive. Some you can change, and others you can't. The risk factors can be divided into 4 main categories. These are personal and medical, behavioral, environmental, social and economic. Knowing the risk factors can guide your strategies to reduce falls in the older population. This graph shows how the number of risk factors can increase the frequency of falls. If an older adult has 3 risk factors, their risk of falling is 60% greater than someone who has no risk factors. If the older adult has 4 or more risk factors, their risk of falling is 78% greater. This clearly demonstrates the importance of reducing as many risk factors as possible to help prevent falls. For example, if you remove 2 risk factors from someone who had 4, their risk of falling drops to 32%. The Canadian Fall Prevention Curriculum adopted what is known as the BEACH Fall Prevention Model, which identifies strategies to prevent falls. These include education, equipment, environment, activity, clothing and footwear, and health management. Behavior change is the common goal for all of these strategies. When older adults adopt these behaviors, they can greatly reduce their risk of falls. However, prevention can also involve a change in behavior by others responsible for an older person's safety. This may include healthcare providers, emergency services, transportation providers, building inspectors, building managers, and family members. The work you do and the knowledge you have about falls and older adults puts you in an excellent position to identify issues. Inform and educate the older adult about risks that you see. As well, you can give simple suggestions or encouragement on how they can reduce risk. It's not always easy for a change in behavior to happen. People or an organization may not be ready to make a change for a variety of reasons. It is important to be aware of this because you may be making suggestions to a client repeatedly and they don't follow through. There are stages of readiness to change behavior, but don't ever give up. Continuing the conversation and offering simple suggestions can help move someone into a different stage of readiness. Let's begin with education. Many older adults don't recognize falls as a serious health issue until they learn the statistics, or they or someone they know experiences a fall. Many believe falls are a normal part of aging, and that falls are accidents and can't be prevented. During your contact with clients, you can make them aware, increase their knowledge, and give them simple ideas on how to reduce their risks. Knowledge allows people to make informed choices. There is a wide selection of equipment that can help an older adult in their daily activities. In order for equipment to be effective in preventing a fall, the individual needs to be using the right equipment for their need. For example, do they use a cane or is a walker more suitable? Do they have grab bars in the bathroom? It's important that the equipment be used properly and be in good working order. Report any concerns to the client, family member, or supervisor as appropriate. A cane needs to be fitted to an individual for the correct height. Even though you are not measuring or fitting someone for a cane, you may notice that a cane is too long or too short. A cane that is too long or too short does not offer stable support. The correct height for a cane is determined by turning the cane upside down, and the tip should be at the level of the wrist. If you suspect the cane is too long or too short, you can discuss your observation with the individual and report your concerns with your supervisor. Refer to diagram as visual. Check the cane tip regularly and ask the individual to replace it as required. Like a cane, the correct height of the walker is at the wrist level. Walking inside the walker offers the most stability. Some older adults hunch over and push the walker too far in front. This is not safe, is less supportive, and places strain on the back. Encourage the older adult to use the handbrakes on the walker when transferring. If you have any concerns about the mobility aid that an older adult is using, report it to your supervisor. There is good evidence to support the removal of hazards as a strategy for reducing fall risks. Tripping and fall hazards to look for include spills, unsafe carpet and mats, broken or unstable furniture, poor lighting, and clutter. Hazards may also exist in institutions. Examples include beds that are too high, slippery floors, and cluttered rooms and hallways. Changes to make the environment safer may include the use of specific equipment. For example, the professional installation of grab bars and getting a bath seat. More complex strategies may include building a ramp, installing handrails by stairs, or enlarging a doorway. Home care agencies often have an assessment or checklist looking at the safety of the environment. This is important for both client and staff safety. Funding for adaptations may be available through municipal, provincial, or federal programs. In this slide, there are a number of bathroom safety features. For example, 2 grab bars in the tub area, a long rubber mat that covers the entire surface of the tub, a handheld shower, a bath seat, and a bath mat with rubber backing. There are a few points to consider with respect to grab bars. Professional installation is the best. Grab bars with suction cups are not safe. If the client has a grab bar attached to the side of the tub, check that the clamps are tight before using. A grab bar beside the toilet may also be required. As in any other room, good lighting is another important consideration. Other tips when providing bathing assistance include wiping water off the floor and avoiding the use of bath oil. Cleaning both sides of the bath mat is an important consideration because soap and grime can build up, making the mat slippery. The bathroom is a location where many falls occur, so every effort should be made to make it as safe as possible. Strong evidence exists on the benefits of physical activity for reducing the risk of falling in older adults. It is one of the most important things an older adult can do. The National Physical Activity recommendations for older adults 65 plus are at least 150 minutes of moderate to vigorous intensity aerobic activity per week in bouts of at least 10 minutes or more, and balance, muscle, and bone strengthening activities at least 2 days per week. These recommendations are what older adults need to be doing to achieve health benefits and to improve and maintain their functional abilities. This can help to prevent falls. No matter what fitness or mobility level, there's a program that can help. At every opportunity, encourage older adults to be active. Being socially connected is known to improve quality of life and health outcomes. Reinforce and encourage the client to participate in activities. Clothing should not restrict movement. It needs to be easy for the person or care provider to manage when dressing and toileting. The older adult should have a good pair of well-fitted, low-heeled walking shoes. Slippers should have backs and non-slip rubber soles. Loose footwear like flip-flops and some sandals should be avoided. As discussed under personal and medical risk factors, many medical conditions are known to contribute to the risk of falling. However, when properly assessed and treated, many of these risks can be reduced or eliminated. Health management is a key strategy in preventing falls. This would include a regular follow-up with a physician or healthcare provider. It's important that the older adult report any fall or near miss so that the cause can be identified and preventive measures taken. An annual vision assessment will help detect and treat eye conditions early and identify needs for corrective lenses. An annual medication review, or when new medications are started, will help with drug interactions, side effects, and management. Let's discuss this in more detail. Older adults absorb and process medications less efficiently. This can result in a dose being too high and the person having adverse reactions or side effects. The type of medication can also cause problems. For example, sleeping pills and antidepressants are known drug groups that increase the risk of falling. Judgment, alertness, coordination, and balance can all be affected. Excessive alcohol and the combination of certain drugs and alcohol is also a fall risk. Older adults don't often identify medication as a risk factor for falls. To help them manage their medications, encourage the use of one pharmacy, the use of dosets or blister packs, disposing of old expired medications at the pharmacy, and keeping a current list of medications, including vitamins, over-the-counter drugs, and herbal supplements. Any concerns related to medication should be reported to your supervisor. It's important for older adults to eat a healthy, balanced diet and to stay well hydrated to carry out their daily activities. Poor nutrition can affect how an older adult reacts to and recovers from an injury. Research has found vitamin D and calcium reduces the risk for falls. If there are no diet restrictions, you can encourage the older adult to eat at least 3 servings of calcium-rich food daily. And they can talk to their pharmacist regarding vitamin D and other supplements. Given the number of risk factors for falls, there are many fall prevention strategies to consider. To make a difference, more than one strategy is necessary. The Beach Fall Prevention Model provides us with best practices on how to prevent older adults from falling. In summary, your goal is to adopt this model. You have now completed this e-learning course on fall prevention for service providers working with older adults. Falls are a serious health issue for older adults, their families, and the healthcare system. You are now able to say why falls are a health problem for older adults, identify what puts an older adult at risk for a fall, include fall prevention into your daily work, and talk about fall prevention with clients and families. A resource section is included for your reference and can be found on the course main page. You can download and print these documents. Please exit this activity and proceed to the course evaluation to provide your feedback. Thank you.